Good evening. My name is Jamina Francois. I currently attend Lincoln Tech. I will be conducting a head-to-toe assessment, and today's date is April 9th, 2022. Knock, knock.
Come in.
Hi, my name is Jamina Francois, and I'll be your nurse for today. So I'm gonna come over here at the sink and perform proper hand hygiene, preferably for about 10 seconds while singing the happy birthday song. Okay, now wiping my hands. Hi, what's your name?
Melanie.
Melanie. Hi, Melanie. How are you?
Good.
And what's your date of birth?
11/02/1992.
Okay. And then can I please take a look at your wristlet to verify your name and date of birth?
Sure.
Thank you. Name and date of birth is correct. Now, are you currently experiencing any pain?
No.
No? No pain at all? Okay, awesome. And do you have any vision issues?
I wear glasses.
You wear glasses? Okay. And do you know where you are currently?
In the hospital?
In the hospital? Okay. And then do you know what season it is?
It is spring.
Spring. And do you know the president?
President is Joe Biden.
Joe Biden. Okay. And do you know what year we're currently in?
2022.
Okay. So the patient is oriented times 4. So now I'm going to be assessing your eyesight. So now I'll be taking out my pen light. So now all I really need you to do is just follow my pen light, okay?
Okay.
All right. So can you look up for me? Can you look to the side? Can you look down? Okay. So her eyes are reactive to light, accommodation, they're equal. And they're bilateral. Okay. Next, I'll be assessing the ears. So I'll be pulling the peanut up and back. Okay. Now, over to the next ear. Pull it up and back. Okay. Ears are bilateral and they're equal. So next, I'll be assessing the tympanic membrane. Equal and bilateral. Okay, next I will be assessing the nose. Okay, patient's nose is equal. There appears to be no drainage. So all I need you to do is cover one nostril. Breathe in, breathe out. So can you do the other side for me? Okay, pain C to the nose is equal. Next I will be assessing the mouth. Can you just open your mouth for me? Thank you. Pull out your tongue. The buccal mucosa is nice and moist. It is pink. The gums are pink. Teeth are still intact. Patient appears to have all her teeth. Do you wear any dentures?
No.
No? Okay. Thank you. And now the mucous membrane is pink. It's pink and moist. Next, I will be assessing the head. I'll be assessing the head by palpating, checking for any signs of cuts, lesions, bruising. No, there's no signs of that. Next, I'll be assessing the shoulders and neck. Okay. I'll be palpitating slightly I will be assessing the tracheal lesion, checking to make sure that it is equal in its midline and it's not deviated to one side versus the other. Next, I'll be assessing the left notes for pre-pulse. And then can you just push your head to the side? Next, I'll be assessing for DVT. Okay. Can you do the other side for me? Thank you. Next, I'll be assessing the skin turgor at clavicle. Okay. So now can you just, so when I push down, I just need you to push up. So I'll be assessing the patient's arms to see if it's equal or not. Can you push down? Okay. Can you push up? Patient's strength is equal. Can you just take? I'll be testing the patient's range of motion. So can you put your hand up? Twist it to the side. Other side. Can you do the other here? Side. Okay. Now can you squeeze my hand as hard as you can? Good. So strength is bilateral. Range of motion is equal and bilateral on both hands. Now I will be checking the patient's respiratory status with my stethoscope. Okay. Now I'll be assessing the patient's lungs. Can you take in a deep breath for me? Good. Okay. So can you just lie down on the bed for me, please? Next, I will be assessing the patient's respiratory system. First, I will be inspecting, then I'll be palpating, starting with the interior, then moving on to the posterior. So first, I'm going to inspect by looking at the patient's skin. Then I will be palpating. Okay. Next, I will be auscultating with my stethoscope. Can you take in a deep breath? Next, take in another deep breath. So there appears to be no crackles, no wheezes in the interior view. The lungs are clear. There's no crackles, no weasels, and lungs appear intact, and it is not diminished. Next, I'll be checking the posterior of the lungs. Can you just slightly turn for me? Thank you. Can you take another deep breath? I will be inspecting and I will be palpating. Okay. Posterior of her lungs appear to be clear. There is no rhonchi without any rails, crackles, or wheezing. And also the lungs are intact and it is not diminished. Recently, have you had any cough?
No.
Any difficulty breathing?
No.
Shortness of breath?
No.
Nothing? Okay. Thank you. Now I'm gonna be going to your cardiovascular system, okay?
Okay.
Okay. So it just means I'm gonna be assessing your heart sounds. Okay. Now I'm gonna put my stethoscopes back on. Okay. Okay. So now starting with your right. So now I'm gonna be checking the 5 areas to listen to your heart. Okay, so I'm gonna be putting on my stethoscope. Are you currently, before I even start, are you currently experiencing any dizziness, lightheaded?
No.
I'll be assessing the 5 heart sounds and vowels. First, starting with the aortic, which is second intercostal space, right intercostal space. And then I'll be going over to the check your pulmonic, which is your second intercostal space on the left side. Then I'll be going down to the Earth's point, which is your S1, S2, and it's the left third intercostal space. Then I'm going down to the tricuspid, which is located in your sternum, fourth intercostal space. And then ending with your mitral, which is the left fifth mid-clavicular. Keyword, All People Loves magazine. Specifically at the fifth intercostal mid-clavicular, I'll be assessing and listening for the apical pulse. And patient's apical pulse is about 14, which is good. (14 times 4). The rhythm is regular, it's not irregular. Next, I'll be assessing the bilateral radial pulse. Can you just take out your wrist on both hands? It is strong, equal on both sides. Can you take out your hands again for me? Now I'll be checking the patient's bilateral refills and then checking to see, preferably it should be about at least no more than 3 seconds. Can I get the other hand, please? And I'm basically checking to see and make sure that her blood returns are adequate. Next, I'll be assessing for any signs of clubbing, any cuts or lesions on the patient's hands. Patient's skin is intact. There's no cuts or lesions. Next, I'll be going over to the gastrointestinal system. So, do you remember the last time you had a bowel movement?
Today.
Today? Okay. What was the color?
Brown.
Brown? Okay. Continent or
Yes,
incontinent?
incontinent.
Or
Yes,
incontinent.
incontinent.
Okay. Do you experience diarrhea?
No.
No? Okay. No bloating?
No.
No pain?
No.
No nausea or vomiting?
No.
When you went to the bathroom, was there any blood?
No.
Any discharge?
No.
No? Okay. Now, can you just have, to just lay down for me? And then let me just evaluate. Okay. First, I'm going to be inspecting, and then I'm going to palpitate, okay? Can I just lift up your shirt? Okay. The abdominal is flat. It is not distended. It is not concave. The skin is intact. It is clear. There's no signs of abrasions, lesions, or cuts. Next, I'm going to also take the bowel sounds. I'm going to be putting on my stethoscope. So first, I'm going to start at the right lower quadrant. Then moving up to the right upper quadrant. Next, I'm going to be going to the left upper quadrant. Then I'll be going to the left lower quadrant. Vital signs are active. It is not hyperactive, nor is it diminished. No. And vital sign is not absent. Can you have a... Okay, just breathe. Relax a little. So currently I am palpitating with my hand to see if there's any tenderness. So it's soft to touch without any tenderness. Okay. Her bowel sound is currently positive and is not hyperactive. Now you can have a seat up, please. Next, I'll be assessing the urinary system. Do you remember the last time you peed?
Today.
Today? Was there any weird smells?
No.
Any weird discharge?
No.
Colors?
No.
Did you have any issues like while you're peeing? Did it burn? Did
No.
it sting?
No.
No? Okay. Was the flow normal?
Yes.
Okay. And then do you pee on a regular basis?
Yes.
Okay. And do you drink a lot of water?
Yes.
Have you had any accidents going to the bathroom?
No.
Okay. So now can you just have a to lay back down for me, please? Next, I'll be assessing for her toes for bilateral or capillary refills. So I'm just going to be removing the patient's socks. Thank you. I need to remove the other one. Thank you. So I'm checking her toes to see if the blood returns. Capillary refill. Okay. Good. Okay. Capillary refill is good. It's less than 3 seconds. So next, I'm going to be checking the bilateral pedal pulses. It is bilateral and it is strong. It is not weak or bounding, nor is it absent. Okay, perfect. Now can you press down? As if you're driving. Now, okay, now push up. Okay. I'm assessing for strength. It is bilateral. It is strong on both sides. Can I just check? Pull up the hands. I'm checking her ankles and calves for any signs of edema or swelling. There appears to be no signs of edema or swelling. Checking the skin for any cuts or lesions. So the skin is intact. There's no cuts or bruises. Perfect. Thank you. So there is no cuts, lesions, bruises, skin is intact. Next, I'll be putting back on the patient's socks. Lastly, I'm going to be assessing the patient's gait and balance. So can you just sit up slowly, rise slowly? Thank you. And then can you just rise up, please? So I'm going to be checking, applying the Morse scale. So can you just walk forward, please? Okay. Keep walking. And then can you just go slowly backwards? One step at a time. Don't rush. Okay. Patient's balance is equal. There's no wrist fall, I would suggest. And also gait is intact and steady. Gait is steady. She is able to walk. And last thing, can you stand on one foot for me like this? Yeah. And then touch your nose. Patient's balance is equal and steady. All right, thank you.